Remedies and treatment of obesity. All too often, obesity prompts a strenuous diet in the hopes of reaching the ideal body weight. Some amount of weight loss may be accomplished, but the lost weight usually quickly returns. More than 95% of the people who lose weight regain the weight within 5 years. It is clear that a more effective, long-lasting treatment for obesity must be found. We need to learn more about the causes of obesity, and then we need to change the ways we treat it. When obesity is accepted as a chronic disease, it will be treated like other chronic diseases such as diabetes and high blood pressure. The treatment of obesity cannot be a short-term fix, but has to be an ongoing, lifelong process. Obesity treatment must acknowledge that even modest weight loss can be beneficial. For example, a modest weight loss of 5% to 10% of the initial weight and long-term maintenance of that weight loss can bring significant health gains, including lowered blood pressure, reduced blood levels of cholesterol, reduced risk of type 2 diabetes, decreased chance of stroke, decreased complications of heart disease, decreased overall mortality. It is not necessary to achieve an ideal weight to derive health benefits from obesity treatment. Instead, the goal of treatment should be to reach and hold to a healthier weight. The emphasis of treatment should be to commit to the process of lifelong healthy living, including eating more wisely and increasing physical activity. In sum, the goal in dealing with obesity is to achieve and maintain a healthier weight. The role of physical activity and exercise in obesity. The National Health and Examination Survey showed that people who engage in limited recreational activity were more likely to gain weight than more active people. Other studies have shown that people who engage in regular strenuous activity gain less weight than sedentary people. Physical activity and exercise help burn calories. The amount of calories burned depends on the type, duration, and intensity of the activity. It also depends on the weight of the person. A 200-pound person will burn more calories running 1 mile than a 120-pound person, because the work of carrying those extra 80 pounds must be factored in. But exercise as a treatment for obesity is most effective when combined with a diet and weight loss program. Exercise alone without dietary changes will have a limited effect on weight, because one has to exercise to simply lose 1 pound. However, regular exercise is an important part of a healthy lifestyle to maintain a healthy weight for the long term. Another advantage of regular exercise as part of a weight loss program is a greater loss of body fat versus lean muscle compared to those who diet alone. Other benefits of exercise include improved blood sugar control and increased insulin sensitivity, reduced triglyceride levels and increased good HDL cholesterol levels, lowered blood pressure, a reduction in abdominal fat, reduced risk of heart disease. Remember, these health benefits can occur independently with or without achieving weight loss. Before starting an exercise program, you should talk to your doctor about the type, and intensity of the exercise program. General exercise recommendation. Perform 20 to 30 minutes of moderate exercise 5 to 7 days a week, preferably daily. Types of exercise include walking, stationary bicycling, walking or jogging on a treadmill, stair climbing machines, jogging, and swimming. Exercise can be broken up into smaller 10-minute sessions. Start slowly and progress gradually to avoid injury, excessive soreness, or fatigue. Over time, build up to 30 to 60 minutes of moderate to vigorous exercise every day. People are never too old to start exercising. Even frail elderly individuals, 70 to 90 years of age, can improve their strength and balance. Exercise precautions. The following people should consult a doctor before vigorous exercise. Men over age 40 or women over age 50. Individuals with heart or lung disease, asthma, arthritis, or osteoporosis. Individuals who experience chest pressure or pain with exertion or who develop fatigue or shortness of breath easily. Individuals with risk of developing coronary heart disease such as high blood pressure, diabetes, cigarette smoking, high blood cholesterol. A patient who is obese. The role of diet in the treatment of obesity. The first goal of dieting is to stop further weight gain. The next goal is to establish realistic weight loss goals. While the ideal weight corresponds to a BMI of 20 to 25. This is difficult to achieve for many people. Thus, success is higher when a goal is set to lose 10 to 15% of baseline weight as opposed to 20% to 30% or greater. It is also important to remember that any weight reduction in an obese person would result in health benefits. One effective way to lose weight is to eat fewer calories. 1 pound is equal to 3,500 calories. In other words, you have to burn 3,500 more calories than you consume to lose 1 pound. Most adults need between 1,200 to 2,800 calories per day, depending on body size and activity level, to meet the body's energy needs. If you skip the bowl of ice cream, then you will be 1/7 of the way to losing that pound. Losing 1 pound per week is a safe and reasonable way to take off extra pounds. The higher the initial weight of a person, the more quickly he or she will achieve weight loss. This is because for every 1 kilogram of body weight, approximately 22 calories are required to maintain that weight. So for a woman weighing 100 kilograms, he or she would require about 2,200 calories a day to maintain his or her weight. While a person weighing 60 kilograms would require only about 1,320 calories. If both ate a calorie-restricted diet of 1,200 calories per day, that heavier portion would lose weight further. Age also is a factor in calorie expenditure. Metabolic rate tends to slow as we age, so the older a person is, the harder it is to lose weight. There is controversy in regard to carbohydrates and weight loss. When carbohydrates are restricted, people often experience rapid initial weight loss within the first 2 weeks. This weight loss is due mainly to fluid loss. When carbohydrates are added back to the diet, weight gain often occurs simply due to a regain of the fluid. General diet guidelines for achieving and maintaining a healthy weight. A safe and effective long-term weight reduction and maintenance diet has to contain balanced, nutritious food to avoid vitamin deficiencies and other diseases of malnutrition. Eat more nutritious food that have low energy density. Low energy dense foods contain relatively few calories per unit weight. Examples of low energy dense foods include vegetables, fruits, lean meat, fish, grains, and beans. For example, you can eat a large volume of celery or carrots without taking in many calories. Eat less energy dense foods. Energy dense foods are high in fats and simple sugars. They generally have a high calorie value in a small amount of food. The United States government currently recommends that a healthy diet should have less than 30% fat. Fat contains twice as many calories per unit weight than protein or carbohydrates. Examples of high energy dense foods include red meat, egg yolk, fried foods, high fat or sugar fast foods, sweets, pastries, butter, and high fat salad dressings. Also, cut down on foods that provide calories but very little nutrition, such as alcohol, non-diet soft drinks, and many packed high-calorie snack foods. About 55% of calories in the diet should be from complex carbohydrates. Eat more complex carbohydrates such as brown rice, whole grain bread, fruits, and vegetables. Avoid simple carbohydrates such as table sugars, sweets, donuts, cakes, and muffins. Cut down on non-diet soft drinks. These sugary soft drinks are loaded with simple carbohydrates and calories. Simple carbohydrates cause excessive insulin release by the pancreas, and insulin promotes growth of fat tissue. Educate yourself in reading food labels and estimating calories and serving sizes. Consult your doctor before starting any dietary changes. Your doctor should prescribe the amount of daily calories in your diet. The role of medication in the treatment of obesity. Medication treatment of obesity should be used only in patients who have health risks related to obesity. Medications should be used in patients with a BMI greater than 30 or in those with a BMI of greater than 27 who have other medical conditions that put them at risk for developing heart disease. Medications should not be used for cosmetic reasons. Medications should only be used as an adjunct to diet modifications and an exercise program. Like diet and exercise, the goal of medication treatment has to be realistic. With successful medication treatment, one can expect an initial weight loss of at least 5 pounds during the first month of treatment and a total weight loss of 10 to 15% of the initial body weight. It is also important to remember that these medications only work when they are taken. When they are discontinued, weight gain can occur. The first class of medication used for weight control causes symptoms that mimic the sympathetic nervous system. They cause the body to feel under stress or nervous. As a result, the major side effect of this class of medication is high blood pressure. This class of medication includes sibutramine and phentermine. These medications also regulated by brain chemicals called neurotransmitters. Examples of neurotransmitters include serotonin, norepinephrine, and dopamine. Anti-obesity medications that suppress appetite do so by increasing the level of these neurotransmitters at the junction between nerve endings in the brain. Phentermine. Phentermine, the other half of phen, suppresses appetite by causing a release of norepinephrine in the body. Phentermine alone is still available for treatment of obesity, but only on a short-term basis. The common side effects of phentermine include headache, insomnia, irritability, and nervousness. Fenfluramine and dexfenfluramine suppresses appetite mainly by increasing release of serotonin by the cells. Both fenfluramine and dexfenfluramine were withdrawn from the market in September 1997 because of association of these two medications with pulmonary hypertension and association of fen with damage to the heart valves. Since the withdrawal of fenfluramine, some have suggested combining phentermine with fluoxetine, a combination that has been referred to as fen-bipro. However, no clinical trials have been conducted to confirm the safety and effectiveness of this combination. Therefore, this combination is not an accepted treatment for obesity. Sibutramine. In December 1997, the United States Food and Drug Administration approved sibutramine, a drug which increases the level of serotonin and norepinephrine in the brain, to treat obesity. However, the drug was withdrawn from the market in October 2010 because clinical trial data indicated that it is associated with an increased risk of heart attack and stroke. Orlistat. The next class of drug changes the metabolism of fat. Orlistat is the only drug of this category that is US FDA approved. This is a class of anti-obesity drugs called lipase inhibitors or fat blockers. Fat from food can only be absorbed into the body after being broken up by digestive enzymes called lipases in the intestines. By inhibiting the action of lipase enzymes, orlistat prevents the intestinal absorption of fat by 30%. Drugs in this class do not affect brain chemistry. Theoretically, orlistat also should have minimal or no systemic side effects, because the major locale of action is inside the gut lumen and very little of the drug is absorbed. The US Food and Drug Administration approved orlistat capsules, branded as ELLI, as an over-the-counter treatment for overweight adults in February 2007. The drug had previously been approved in 1999 as a prescription weight loss aid whose brand name is Xenical. The OTC preparation has a lower dosage than prescription Xenical. Orlistat is recommended only for people 18 years of age and over in combination with a diet and exercise regimen. People who have difficulties with the absorption of food or who are not overweight should not take orlistat. Overweight is defined by the US National Institutes of Health as having a body mass index of 27 or greater. Orlistat can be taken up 2 to 3 times a day with each fat-containing meal. The drug may be taken during the meal or up to 1 hour after the meal. If the meal is missed or is very low in fat content, the medications should not be taken. The most common side effects of orlistat are changes in the bowel habits. These include gas, an urgent need to have a bowel movement, oily bowel movements, oily discharge or spotting with bowel movements, an increased frequency of bowel movements, and the inability to control bowel movements. Women may also notice irregularities in the menstrual cycle while taking Orlistat. Side effects are most common in the first few weeks after beginning to take Orlistat. In some people, the side effects persist for as long as they are taking the drug. People with diabetes, thyroid conditions, who have received an organ transplant, or who are taking prescription medications that affect blood clotting should check with their physician before using Orlistat, since drug interactions with certain medications are possible. A long-term decrease in fat absorption can cause deficiency of fat-soluble vitamins. Therefore, patients on Orlistat should receive adequate vitamin supplementation. Belviq. In June 2012, the FDA approved Belviq as a weight loss medication. The medication works by controlling appetite. According to the FDA data, nearly half the patients using the medication lost at least 5% of their starting weight, which is more than double that lost by patients in the control group. This was only true for patients without type 2 diabetes. The medication is approved for patients who are obese or overweight with one weight-related health issue. The predominant side effects were headache and dizziness as well as fatigue. In patients with diabetes, low blood sugar was also a concern with taking Belviq. Simia. Simia is the newest medication approved for weight loss. It is a combination of phentermine and topiramate extended release. As with the other medications, it is only approved for patients who are obese or overweight with one weight-related health issue. According to the FDA data, a statistically significant greater proportion of the patients taking Simia achieved 5% and 10% weight loss. All patients in the study were also encouraged to eat a well-balanced and reduced calorie diet. It is important to note that Simia can lead to birth defects, and it is important for women to know that they are not pregnant before starting the medication. Other possible serious side effects include increased heart rate, eye problems, and suicidal thoughts. In patients with diabetes, low blood sugar was also a concern when taking Simia. Meal substitutes, artificial sweeteners, and OTC products. Meal substitutes. When used as substitute for regular meals, meal substitutes are a convenient way to reduce calories, a part of a low-calorie diet plan. A typical meal substitute available in powder and liquid form is SlimFast. Ensure is another meal substitute available in both liquid and bars. Meal substitutes should provide protein and be low in fat and calories. The label should include the amount of calories per serving and the percentages of protein, carbohydrates, and fats. The total number of calories per serving is predetermined, so it is easier to keep track of the daily consumption of calories. Artificial sweeteners. Saccharin and aspartame are sugar substitutes that provide little or no calories. They may be used as a substitute for table sugar. Using saccharin instead of a teaspoonful of sugar eliminates 33 calories from the diet. People with phenylketonuria, a serious genetic disorder in which an individual is unable to break down and eliminate an amino acid, phenylalanine, should not use aspartame because it contains phenylalanine. Fructose, sorbitol, and xylitol may be used as alternatives to sugar, but they provide more calories than saccharin and aspartame. Excessive use of sorbitol also may cause diarrhea. Over-the-counter weight loss products. Despite claims by manufacturers, the use of OTC products alone does not cause weight loss. Herbal weight loss products or preparations called fat burners are even more misleading. These products may contain a combination of mahang, white willow, Hoodia gardoni, and guarana or kola nut. These agents are stimulants which theoretically increase the metabolism and help the body break down fat. Nevertheless, there is no evidence that they are effective for weight loss. In addition, mahong has been linked to serious side effects such as heart attacks, seizures, and death. Chromium also is a popular ingredient in weight loss products, but there is no evidence that chromium has any effect on weight loss. Weight loss teas contain strong botanical laxatives that cause diarrhea and loss of water from the body. Diarrhea and water loss lead to the depletion of sodium and potassium and can lead to dehydration. Although an individual's weight may decrease, the loss is due to the decrease in fluid and is only temporary. Moreover, low sodium and potassium levels may cause abnormal heart rhythms and can even lead to death. Guar gum preparations have also been promoted as a weight loss agent. Guar gum is thought to work by leading to a feeling of fullness early in the meal. It has not been scientifically proven and has been associated with abdominal pain, gas, and diarrhea. All the OTC products discussed above are not considered drugs and are therefore not regulated by the Food and Drug Administration. As a result, there is little information on their effectiveness or safety. You should discuss any OTC weight loss products you are planning with your healthcare professional. How can patients choose a safe and successful weight loss program? Scientists have made tremendous strides in understanding obesity and in improving the medication treatment of this important disease. In time, better, safer, and more effective obesity medications will be available, but currently there is still no magic cure for obesity. The best and safest way to lose fat and keep it off is through a commitment to a lifelong process of proper diet and regular exercise. Medications should be considered helpful adjuncts to diet and exercise for patients whose health risk from obesity clearly outweigh the potential side effects of the medications. Medications should be prescribed by doctors familiar with the patient's conditions and with the use of medications. Medications and other herbal preparations with unproven effectiveness and safety should be avoided. Almost any of the commercial weight loss programs can work, but only if they motivate you sufficiently to decrease the amount of calories you eat or increase the amount of calories you burn each day. What elements of a weight loss program should a consumer look for in judging its potential for safe and successful weight loss? A responsible and safe weight loss program should be able to document for you the 5 following features. The diet should be safe. It should include all the recommended daily allowances for vitamins, minerals, and proteins. The weight loss diet should be low in calories only, not in essential foodstuffs. The weight loss program should be directed toward a slow, steady weight loss unless your doctor feels your health condition would benefit from more rapid weight loss. Expect to lose only about a pound a week after the first week or two. With many calorie restricted diets, there is an initial rapid weight loss during the first 1 to 2 weeks, but this loss is largely fluid. If you plan to lose more than 15 to 20 pounds, have any health problems, or take medication on a regular basis, you should be evaluated by your doctor before beginning your weight loss program. A doctor can assess your general health and any medical conditions that might be affected by dieting and weight loss. Also, a physician should be able to advise you on the need for weight loss, the appropriateness of a weight loss program, and a sensible goal of weight loss for you. If you plan to use a very low calorie diet, you should do so under the close supervision of a healthcare professional. Your program should include plans for weight maintenance after the weight loss phase is over. It is of little benefit to lose a large amount of weight only to regain it. Weight maintenance is the most difficult part of controlling weight and is not consistently implemented in weight loss programs. The program you select should include help in permanently changing your dietary habits and level of physical activity, and to alter a lifestyle that may have contributed to weight gain in the past. Your program should provide behavior modification help, including education in healthy eating habits and long term plans to deal with weight problems. One of the most important factors in maintaining weight loss appears to be increasing daily physical activity. Try to be more active throughout the day and incorporate some simple calorie burners in your everyday routine. Even the most basic activities, such as taking an after dinner walk, using the stairs at the mall or office instead of taking an escalator or elevator, park your car farther away so you have a longer walk. You can get prepared for more regular exercise like walking or jogging. You may choose to incorporate an individually tailored exercise program into your schedule. A commercial weight loss program should provide a detailed statement of fees and costs of additional items such as dietary supplements. Obesity is a chronic condition. Too often, it is viewed as a temporary problem that can be treated for a few months with a strenuous diet. However, as most overweight people know, weight control must be considered a lifelong effort. To be safe and effective, any weight loss program must address the long term approach, or else the program is largely a waste of time, money, and energy.